that have symptoms. So again, if somebody has symptoms, urinating problems, you shouldn't assume that it's aging. So you just keep quiet and stay with that. If you come early, the symptoms might lead us to picking up the cancer early and then offering treatment. The screening, next slide. The screening recommendations vary for different continents and different societies. But in Nigeria, we use the NCCN guidelines, and the recommendation is that men should start screening at the age of 45. So a 45-year-old man should first go to the doctor, not that he's necessarily feeling sick, but just inquire that you want to screen yourself for prostate cancer. And it also, at the extreme, says at 75, we can slow down on screening. So if a man has screened up to 75 years of age, he can slow down because the potential for having a big, aggressive disease is less at 75. Next slide, please. So for men between 45 and 75, what is expected for a man to be doing? If a man does a PSA for the first time, and the PSA is just 1. By the way, the normal PSA is 0 to 4 nanograms per mil. If a man does a PSA and it's 1, that means his risk for cancer is quite low. So he can now be doing it 2 or 4 yearly. You know, if he does it and it's between 1 and 3, the recommendation is that he does it more frequently. Okay, so all of this is trying to create the awareness that there's a red flag and you need to be checked on properly. Next slide. I'll go to the treatment options briefly. Next slide again. I'll skip this. For treatment, we use drugs to treat prostate diseases. If it is the benign non-cancerous growth, we give certain drugs that are very commonly available in the market. You know, if it is prostatitis, the inflammation, we use antibiotics. And these antibiotics can be given for a long time. This is one condition where antibiotics are given for a long period of time. So men come asking that, why are they giving me antibiotics for such a long period? Because the prostate inflammation is quite difficult to penetrate. So if you are giving antibiotics for prostatitis, you must give antibiotics for up to 1 month, you know, for you to get good results. Next slide. Now, apart from drugs, surgeries can be offered. So it depends on whether it is the benign growth or the cancerous growth. But basically, what would make one offer surgery instead of drugs? For instance, for the benign growth, if the man's BPH is progressing, he's taking those drugs, but still the urinary flow is getting worse. Or he gets to a point he's unable to urinate and then insert a catheter. It becomes very uncomfortable for the man to carry a catheter, you know, for a very long time. So surgery is offered at such times. Or the man is wetting himself, he's incontinent of urine, or the prostate enlargement is beginning to affect his kidneys. We now have to do something else. Next slide. Surgery for cancer is also available, and this can be done by different methods. Open method, or the more modern ones called endoscopic methods, which are like keyhole surgery. Radiotherapy can be done to treat prostate cancer. Hormonal treatment can also be offered. Let's go to prevention quickly, where I'll try and end up my discussion. Prevention. Next slide, yes. Next slide, yes. Good. So the prevention will target the modifiable risk factors that we have talked about. And diet comes in very handy here, because this is something that we eat, but what you eat can determine what you become in future. So basically, we advocate that men should have a healthy diet, which is rich in fruits and vegetables, whole grains, and lean protein. So lean protein, fish, skinless chicken, instead of beef, whether it's goat, beef, and all the rest. These are advocated because they are lean meat. I mean, the source of lean protein. We should limit red meat intake and high-fat food. There are some vegetables or fruits that are rich in lycopene. For instance, tomatoes. So fresh tomatoes are good for prostate health. Selenium is also a mineral that is very good for prostate health, and it's readily available in vegetables, in seafoods, in nuts. We can also get vitamin E. So these are things that help keep our prostates healthy. Green tea has what we call antioxidants. Cancer cells they like a lot of oxygen. So if you give things that will mop up the oxygen and then starve the cancer cells, they don't like to thrive in such environments. So green tea is good. Moringa is also being found and has been studied in Nigeria actually to be very, very good to, try to reduce the risk of prostate cancer. Soya beans milk, soya beans products are also extremely important and good for this same purpose. Next slide. Regular exercises. Exercises generally would keep a man healthy, maintain his overall health status. Obesity can be dealt with being healthy. Exercise will stimulate your immune system, gives it a boost, and you have more anti-inflammatory effects in your body. It improves blood circulation, generally speaking. So exercises are very, very good. 145 minutes of exercise in a week for an adult male is not bad. That's like 3 times 30 minutes, or 45 minutes, 45 minutes, 45 minutes, at least in a week, 3 days in a week. If you can do that, it's healthy enough. Next slide. Then we've talked of the importance of regular checkups. So that's another excellent way of preventing problems. One aspect of prevention is that if something is picked early, it's better than when it is picked late. So that is one way of prevention. And this prevention for us is checking our PSA and having a regular checkup with the doctors. Next slide. And next slide again. We should avoid smoking, habits that can make us develop problems with cancer. Smoking and alcohol, like I said, they are all things that increase the risk for prostate cancer and even other cancers, not only just prostate. Next slide. Staying hydrated. This is another very good point because water is good. It detoxifies us. It detoxifies our systems. It reduces the risk of infection, and we've talked about what infection can do to the prostate. It reduces men from having kidney stones. So we should all stay well hydrated. And we all are aware of the problems with global warming. With the weather, the climate is getting more and more harsh on us. So if we have to make a conscious effort of staying hydrated, it will help our systems. Finally, next slide. I'll just say in conclusion, and these are probably the take-home points, we should maintain a rather proactive approach to prostate health. How do we enhance this proactive approach? Regular screening. How do we screen? Get your PSA checked once you hit 45. If you have not, it's not late. You must have a baseline. Secondly, a healthy lifestyle. We've talked of diet. We've talked of habits that we should avoid. We've talked of staying hydrated. We've talked of avoiding obesity, regular exercises, and all of that. Now, staying informed about symptoms of the diseases, which is what we are doing in this forum, what the All Men's Convention has brought us here to have this little talk, to hear about this issue that we've said is a public health concern, prostate diseases and how it affects men. All of this can significantly impact the overall well-being and early detection of potential issues. And, of course, give us all peace in our homes. Thank you very much.
Yeah, thank you, Prof. I think you will resume your seat here on the high table now because by your lecture, you have made your seat a little bit hotter. Shall we clap for him again? I know that I don't know if there's any person here who hasn't heard of prostate or listened into a seminar like this. So we have a good knowledge, a background knowledge of what he's talking about. It means some of us are already living very healthy. So we are going to take Let me say 1, 2, 3,